Thanks for joining us for another episode of Boom and Bust. I'm your host, Tony Clement. I'm here at the News Forum where all voices matter. Today, we're pleased to have on the program Dr. Chandana Unnithan. She is the Chief Scientific Officer at Lifeguard Digital Health and an expert on blockchain, tech, and digital healthcare. Welcome to the program.
Thank you for the opportunity.
So I guess I'm going to have a general question to start off with. What are the trends in digital healthcare right now?
We are looking at digital health trends, including decentralized and bringing it closer to the clients, bringing mobile solutions and edge computing, blockchain, IoT solutions. These are the trends, particularly in the digital health.
So, and what's driving these changes, Doctor? Is it patient demand or governments or just innovation? What's going on here?
I would actually say it is driven by all of these. So it would be primarily the digital revolution has reached had really far-reaching consequences, particularly after the pandemic, when people were, even though there are technologies available, they were not being used at the utmost possibilities. They were not leveraged. And people do know that it is available, and there is obviously the demand. And it is also another area where it's becoming very important is there is a shortage of health workers overall. During the pandemic, we did lose a lot of strength during the 2 years. And that's also driving these changes. So people are wanting to live independent lives, healthy lives, as much as possible. At the same time, being in touch with their loved ones, care. As we are all independent human beings, we would like to live freely. At the same time, there is increased awareness that these technologies are available. One of the greatest examples is telehealth. For people who have not been experienced with the telehealth as a solution, this has been a boon in disguise in many, many areas.
So tell us, let's just focus on telehealth just for a second. We'll go to some of those other topics in due course, but maybe just describe to our audience how telehealth is being utilized now to be part of the solution.
So during the pandemic in particular, the telehealth became a solution for instead of going to see a doctor. This is mainly to protect the doctors as well as the patients or anyone who's may or may not be infected, even for other types of care that they needed to. So instead of going to a physician or walking to a clinic, this became an opportunity. Even more so because you could use a computer, sit in your living room, not go out, and still talk to a physician as you wanted. Although reluctant at the beginning, this became a very important tool in the hands of the public. Another important area, if you look at seniors and telehealth, if you go to any pharmacy, most of the time the scripts are being offered in the pharmacies. Most of the people who are waiting are senior citizens. If these senior citizens could be at home and still order, talk to a physician, and even get connected eventually to an online pharma where the script can be reached home rather than them going out. Wouldn't that be wonderful?
And just to be clear, a lot of this technology was in some form available pre-COVID, but COVID really accelerated this, did it not?
That's correct. One of what these technologies did exist, and it was probably it was not integrated. So when we're looking at telehealth integration with online pharma or any other forms and bringing it all together into e-health records, which go nationally or similar, it becomes very important that solutions are integrated, and that is the power of technology. comes with a lot of inhibitions regarding privacy, security, integrity of data, hacking, and so on.
Yeah, and we'll definitely touch on those topics. We're going to take a brief break with our guest. We'll be back after that. Please stay with us. And welcome back to Boom and Bust. I'm your host, Tony Clement, here with Dr. Chandana Unnithan. She is the Chief Scientific Officer at Lifeguard Digital Health. Doctor, we were talking a little bit about telehealth before the break. There are other innovations and technologies that are also playing a part. Where does blockchain fit in your estimation?
Blockchain has over a decade or over the last 5 years, it's become a very important area, particularly when it started getting utilized in the healthcare. If you're looking at national the health records or similar, there has been a lot of negativity associated with blockchain previously, maybe due to other sectors. However, once the health sector began using it, there's been a lot more traction into this area where it's used on not only for security of transmission and also security of data. And there's also, unlike people's ideas, there are decentralized hyperledger solutions that are available and is being used for public key infrastructure. It's being used by governments, and these are solutions that bring this technology and build trust, particularly in general public, dealing with healthcare.
So I guess one of the things is blockchain can assist in securing privacy rights. Is it also involved in the accumulation of data from patients, but also in a way that protects their individual privacy rights? Is that part of the solution as well?
That's correct. So it is transmission security mainly and authentication. And the decentralized form of the hyperledger solutions have now become one of the key areas where the person it could be a person, not only a patient, it could be the general person who is looking at the wellness, can be protected while the data is being transmitted, for example, from a mobile device onto a storage. And at that time, the reason this is very important at this time, if you think about solutions such as if you have a pacemaker or ICD device, and what happens if this gets if someone tries to hack in or jam the device. So it's very important in such a situation. The blockchain solutions, particularly currently, the novel technologies is combining this with edge computing, so that there's both these technologies have their own drawbacks, and combinedly they are a good solution for healthcare.
And what about artificial intelligence? Does that technology help as well?
Artificial intelligence is has been introduced in many ways. One of the highlights recently has been things like synchron trying to put in chips, and if someone's immobile and able to still work with their mind and so on. The technologies in artificial intelligence has brought in a lot more. The trust is still to build, and there is how much of it is being used and for what purposes it is being used. If it's a virtual triage for regular certain areas, peer to peer, it may be a start of building the trust in the medical sector. But if it has to be used further and it gets into a regular use into the health sector, it is still some time.
Gotcha. I mean, that's a good point, though. A lot of this new technology it can be so revolutionary, but you do have to have some buy-in from the health providers too, right?
Yes, it is health providers as well as the general public who needs to trust. Some are, in health sector, trust is a very important factor. People, public are mostly very happy to use it for other areas like finance, but when it comes to health, people do get vulnerable, and the trust has to build over time. And the trust across geographies are different. Not every country or every geography is at the same level in accepting technologies.
Indeed. We're going to continue with our guest after the break. Please stay with us. We'll be right back. And we're back here at Boom and Bust. I'm your host, Tony Clement, here with Dr. Chandana Unnithan. She is the Chief Scientific Officer at Lifeguard Digital Health. Doctor, obviously, all of this that we've talked about in the last two segments about these new technologies that are coming into the fore, they do provide patients and providers with more options. How do you see this affecting health outcomes for patients?
Uh, One of the very simple but very important areas is most of the public, if they're interacting with the health sector, there is a move towards using mobile applications. The SaaS solutions, and people would prefer to use mobile solutions and interact. And that is essentially due to the penetration of IoT devices in the market, including Fitbits to watches to anything that continues to monitor their wellness and health. And there are many such devices which are being integrated solutions being offered and connected to the health records so that a physician can monitor them online. Obviously, these are at different phases in different areas again. But one of the most important areas is the mobile applications and the way it is rendered to the public. People are very interested or happy to use an app, and people get used to that. And it is very important, therefore, to make sure that the transmission through a mobile app to a device to your actual wellness is the seamless, privacy protected, secure transmission takes place.
Yeah, and you raise a good point. Obviously, a lot of this has to do with not only health outcomes if you're already sick, but also preventative medicine as well. That seems to be a real growth area. Is that correct?
That is correct. The main area is public health and wellness, and most of the nations are looking at that. Are there prevention is obviously better than cure and treatment. And if you're continuously monitored over a mobile app and you can manage your own health to an extent, it reduces the pressure on the health system as well as the pressure on the general public. You do not, once you're able to prevent a particular crisis. This is where Lifeguard is also involved, looking at different crises and how to prevent this from occurring.
This intersects with my next question, actually, because obviously you probably are aware there's been a lot of concern recently about the resiliency of the Canadian public health care system. So, in your view, does this technology help, and if so, how?
The technology is certainly out there, and it has been used in other geographic areas, which one of very similar nations, such as Australia and Canada. There are some of these solutions which require what is required is integrated care. So, if there is an electronic health record that connects the nation or connects all the provinces, connects pharmacies, labs, any of the touch points where the consumer comes in. And even if you move across different geographies and you're still be able to draw from the same amount of care, that's what is required. It is about integration of all these technologies into something useful for preventive measures.
How can governments in Canada hinder or help with this technology improvement?
Uh, yes. So the one of the areas is I'm sure that this is already being done. That the governments, trying to integrate these technologies into what is available already, and so that these technologies get integrated and talk to each other. The systems are interoperable, and there are already much work being done by many of the provinces, as well as Infoway and other such organizations in making this occur.
We're gonna take a brief break. I'm sorry to do this to you, but we do have to take another commercial break. Hold on to that thought. We'll be right back with you after the break. Please stay with us.
Thank you.
I'm here with Dr. Chandana Unnithan. Please continue your comments. We were talking about integration in healthcare and how technology can help. Please continue with your consideration of the issue.
So in Canada, the health records integration, this is happening at provincial levels, at all provinces. And different provinces are due to the population and other infrastructure and limitations and so on. It takes a while to get to that same level. And once it is integrated, and Canada Health Infoway is also backing with the infrastructure, it's a gateway. Once the foundation is built and integrated in every province, and then connecting it nationally would really help every citizen in Canada, so that if you move from one province to the other or you move somewhere else, all your records, all your health related records are in one place. It just needs to be drawn. It's a central area where you may be allergic to something, and if a particular medication is administered to you, you might not survive. So these are areas where an integrated health service can occur, and every province in Canada, and they're all working towards it to integrate online pharmacies, looking at lab reports being online, bringing it all together. People being monitored in their homes. If you have Parkinson's, if you have diabetic monitoring, all of these can be done through devices which are interconnected and then coming into the same electronic health record, so that a physician who's facing you wherever they are in Canada can actually look after you. And yes,
Please continue. Yeah.
So this is the vision which is ongoing, and the pandemic is no doubt accelerate at this point. Obviously, when you look at the complexities and different type of people and the way things occur, it does take time. And there is also the movement of technologies from an older legacy technologies into a completely new one. Canada's had the opportunity to leapfrog into a novel technologies rather than bringing it back from previous records, because they were not integrated previously, and now it is getting integrated. So that's also an opportunity to be leveraged on.
So, in your estimation, do you think that Canadian innovation is up to par to be a party to these kinds of solutions and this innovation?
The innovation in Canada is out there. There is availability of technology, and as in new technologies come in, there's definitely the availability in the market. I think they need to be utilized best in the market, in the domestic market, and that is where the mobile revolution is actually helping that. People do look for apps for everything these days, including drinking water. try to remind them to take different medication and so on. So integration really is the key.
And we've got about a minute left. So what do you see as the next steps in this innovation and integration?
I think in Canada there is a lot of movement towards securing the infrastructure, and that's where blockchain comes in primarily, and edge computing, which is the latest, so that the the negatives of blockchain actually gets, particularly the power being used so much, gets less and less, and as more of the provincial governments start using novel technologies, it becomes um, a leapfrogging exercise.
Well, it's quite hopeful, very interesting area of innovation and healthcare reform. Dr. Chandana Unnithan, thank you for joining us today. Very interesting presentation, and certainly wish you every success in all the work that you're doing in this area as well.
Um, the area that we are mostly in is trying to prevent overdose deaths from the opioid crisis and senior care. And Lifeguard has been on the forefront of using technology to prevent and anonymously and securing um, your privacy and security using blockchain. So
Fantastic. Well, I wish you, our time is up, unfortunately, but certainly wish you well at Lifeguard and all that you're doing there.
thank you.
Thank you. Very interesting discussion there on digital health reform and innovation happening right now in Canada. Very, very interesting, and I hope you found it interesting too. We'll see you next time.